In Hubei province, there are 63,000 confirmed cases in Hubei province, among which 419,000 cases in Wuhan. Outside Wuhan, there are 11,000 cases. Wuhan, Xiaogan, Huanggang, Junzhou, Ezhou, Suizhou, Jianghan, and Huangshi has accumulated cases of over 1,000. In the 1st of March 2020, the newly added COVID-19 confirmed cases in Hubei province has claimed 196, accounting for 97% of the national total number, and the number first dropped down below over 200 cases. In the newly added cases, there are 193 cases happening in Wuhan, accounting for For the information at other different cities and provinces, there are 2 cases occurred, one in Jinzhou and one in other different city. For Huangshi, Yichang, Xiaoyang, Xianing, Enshi, Xiantao, and Tianmen, Qianjiang, and Shenlongjia, there is no newly added case. To the 1st March 2020, there are 26,000 cases enrolled in hospital, among which 5,461 severe cases and 1,322 mild cases, accounting for 26% of the total number. By the 1st of March 2020, the accumulated death is reaching 2,376. There are 33 death cases occurred in Wuhan, accounting for 67% across the province. By the 1st March 2020, the total cured and dispatched numbers across the province is 23,000, among which there are 1,800 cases in Wuhan, accounting for 76% across the whole province. From the 9th February, for 12 days in a row, the newly added cases has been less than the discharged cases. That is the up-to-date information. Dear friends from the media, dear netizens, good afternoon. Thank you very much for your concern in the medical rescue efforts in Suizhou. To the 1st March 2020, the total reported cases in Suizhou is 1,307 cases, with 854 cases dispatched from the hospital, and we have claimed 34 deaths. After a month of the hard medical efforts, we are seeing the whole scenario being changed quite actively. There's zero growth for the confirmed cases. And for the fever clinics, the recipients' number is come back to the normal level, and the confirmed ratio is reaching 62.2%. For the recent period, we have prioritized the effort to battle against the COVID-19. And we have been focusing on the following 4 parts of our effort. First, we are trying to cut down the transitional methods, and we are adopting all kinds of methods to prevent and control. Starting from the 23rd February, we are adopting all kinds of the transportation limitations in the railway stations, in the bus stations. All the traffic channels has been shut down. On the 6th of February, we have issued a municipal level guidance, and we have also adopted a great network covering every communities. In the 26th of February, we are starting a 24/7 lockdown on all the communities. Private cars are prohibited, and the day-to-day supply is being supported to the community level, and we even go down to the different villages and also the townships. We have organized all the party members to be responsible for a certain dispatch of a certain of a community, and we actually inactivate them to work at a certain area. For the confirmed cases, we have a very centering prevention and treatment. And for their close contact, all of them are being under quarantine. We have enough inventory and storage. We have transformed over 260 different areas and institutions for the quarantine purpose. Second, we are making all-out effort for the medical treatment of the patients. We fully prepare all kinds of the beds, and we take all the patients that we could. There are 4,416 different beds. We have also used 4 different private hospitals to provide the special treatment care for the fever patients. Across the whole city, we have developed mechanisms for the enrollment, treatment, transfer of all the patients. We have also integrated the medical workers and for the whole city, among which there are 328 professional medical workers coming from the Jiangxi emergency medical team, and they have taken over 16 different wards. All the patients is being enrolled in the designated hospitals. For the severe cases, it is all being concentrated in the central hospital in the Suizhou city. Each of them has an independent award. We are also going to speed up our effort to finish all the nuclear asset testings with the external support from the Inner Mongolia and Jiangxi. Currently, the daily testing capacity in our city is reaching 1,000. Third, we have also do a good job in the examinations. We have also conducted an all-out body temperature testing. No single person should be lacked from this network. And we have also a very clear number and information about all of those people who are coming to Suizhou and who depart Suizhou. Currently, we have traced back to 50,800 different suspected cases. Through the dynamic changing and also the big data screening, we have conducted a level-based screening mechanisms to over 12,000 people. We have also organized 16 different teams to go into different levels of the communities, and we covered all the patients who suffered from the fever and shortness of breath. 4 categories of the people and professional workers are being dispatched to go to the community and do the body temperature testing. We have also do a campaign, and we encourage all the citizens in Hubei to report their body temperature information every day through an application. Fourthly, we have also speed up efforts in 3 areas. We have speed up the supply and the guarantee of the medical resources. We procure several different batches of the medical urgent need materials. Jiangxi province has given us several different medical supports, the ambulance N95 masks, and the protective suits. Currently, the PPEs in our city can guarantee 1 week's normal function, and it can be satisfying our basic demand for treatment of the patients. Meanwhile, we have also dispatched all kinds of the one-time-off medical masks to several different pharmacies. Secondly, we have also sped up our normal functions of the city. Suizhou is a city supplying all kinds of the grains, oils, and other different foods and porks. Currently, all the daily necessities in our city can supporting for a 30-day period, and we have also arranged all the energy supplies in our city. We have also increased the frequencies of the sterilizations in the public area, guarantee a normal function of the city. Thirdly, we have also do a quite good psychological consultancy work for the general public and especially for the medical workers who are fighting at the front line. For the changes in the psychologies, we are using a multiple function method to address the psychological problems, and we have cracked down different crimes. We are also going to center on General Secretary Xi Jinping's points and continue our efforts, trying our best to cut off the origins of the infections. We are also going to improve the cure ratios, cut down the mobility and mortality ratios. We are also going to continue our effort to lock down the city. Meanwhile, we are also going to shoulder the certain responsibilities. Here, on behalf of the city municipal governments and all the peoples in our city, we like to extend our heartfelt gratifications to the medical emergency team from Jiangxi province and all the other medical workers who are supporting us. And I also want to pay my tributes for the medical workers who are fighting at the front line. Thank you. We'd like to give the floor to Mr. Chen Ming. Friends from the media, dear netizens, good afternoon. Pairing assistant Suizhou City is a task granted by the Central Military Commission and also the CPC central governments. General Secretary Liu Qi and Governor Li has worked on themselves, and they have talked to the municipal government of Suizhou province. Through the radio talks, they get updates about what is happening in Suizhou, and they have required all the medical workers to treat themselves as a citizen in Suizhou. So here I'd like to brief you in 4 different parts about how do we launch our work. Firstly, we convened the team in a very short period of time after hearing about the mission. On the 6th of February, 11th of February, and the 17th of February, we sent 3 batches of the medical workers. And within a short period of 24 hours, we sent them to Suizhou. Currently, there are 389 medical workers from Jiangxi province who is working at Suizhou, among which 111 doctors, 124 nurses, covering several departments, including the respiratory diseases and ICU department. We firmly believe that where the disease is, where our party is, we also formed a temporary party organization. And we also want them to fully play their role as a party member, and we also want the party member to play a role as a pioneer and a trailblazer. We have also prioritized our medical effort to the patients. By formulating special expert teams using the remote video treatment therapies, we are providing a tailor-made, personalized treatment plans for each of the patients in Suizhou City. We have tried our best to improve the curement ratios. Up to the 21st of February, we have taken over 12 different hospital awards and managing 554 different patients. In total, we have cured 336 patients in the Suizhou city. While doing a very good job in the medical treatment, we are also actively participating in the nucleic acid testing. Currently, we finished over 2,866 different nucleic acid testing in Suizhou City. In the medical necessities and daily necessities, Jiangxi is trying our best to support Suizhou City. 10 ambulances are being transported from Jiangxi province, among which 5 of them are negative pressure ambulances. We have also donated 50,095 medical masks and 5 tons of the TCMs, 9 different monitoring systems for the remote medical treatment. Throughout the Jiangxi province, all works of the society donated for Hubei province and Suizhou city. Fourthly, we adopted a very strict disciplines. We also strengthened the self-protective awareness. We believe that we are going to win the battle against the COVID-19, and we are also going to welcome our medical workers. Every night, at midnight, we rearrange the working plans for each of the medical workers, and we also want to protect and care for our medical workers. We provided a very good psychological support to guarantee their psychological and physical health. Municipal governments and provincial governments at Hubei and at Suizhou, they have given us all-rounded support. So here, on behalf of the medical emergency team from Jiangxi province, I'd like to send them my heartfelt gratifications. Going forward, we are also going to center ourselves based on the General Secretary Xi Jinping's idea, and we are also going to fully implement the requirement of the General Secretary Xi Jinping. Together with all of you, we are going to win the battle against the COVID-19. Now the floor is open for media. Please identify yourself before the questions. With CCTV, as General Secretary Xi Jinping pointed out, that we are also going to adopt a quite strict control of the transportation methods. So I believe that Suizhou is a city neighboring Nanyang and Xinyang in Henan province. How did we manage the transportation methods and also the highways? Thank you very much to the question. Suizhou is the northern gateway of Hubei province, bordering Nanyang and Xinyang. In Henan province, we have 26 different highways, among which 6 of the highways are connecting Suizhou with other different provinces. In terms of the controlling of the transportation panels, we have set up different stations. On the 24th of January, we have kept 1 controlling ETCs and close up all the other ETCs. In the national level highways and the provincial level highways, we cut down all the highways connecting to the Henan province. We have also conducted and adopted very strict controlling panels, and we adopted 24/7 3 shifts. And for each of the shifts, it is being led by 1 CPC comrades, with the team members covering the public security and also the transportation bureaus. And we have also returned over 3,000 different personnel. Thirdly, we have smoothened up the green channels based on the requirements. We have followed up 1, 2, 3, 4, 5 testing method to the personnel, testing their body temperatures, questioning their previous histories, recording their basic information, and give them permits to get out of the Hubei with a good and strict controls in the highways. Currently, For all the migrant workers in Suizhou City, it is totaled 223 people. We gave them a concentrated sheltering place in a cozy hospital, and we have also provided them a very good service in the hospital, and that helps us to gain their support with legal daily. What kind of a method did the Suizhou government adopt to treat the COVID-19 patients? Thank you very much for your question. A good guarantee of the life and livelihood of the people across the city is our priority. During the outbreak of the COVID-19, we have adopted the following measures. First, we categorize different patients, combining with the different treatment capacities in different institutions. We divided them into the mild and severe cases, child cares, and also the pregnant women. We open up 16 different medical institutions to the general public. For the severe cases, we have guaranteed the emergency department is open up 24/7. For those who are going through a kidney treatment, we have opened up healthy examinations, and we have also built up a healthy record for all of these patients. For the chronic disease patient, we have fully played the role as a community and as a village through the telephones and through the internet. We have collected their medical demands, and we have procured all the drugs for them. Second, we have built up a closed-loop operation mechanism during the outbreak for all the patients, especially all of the hospital institutions above the level 2. We have organized 22 different operation teams, transferring and referring all the patients between the different levels. This mechanism is being coordinated by the city governments, and this has guaranteed all the normal enrollment of the patients. Thirdly, we have also got a very good prevention and control at different hospital institutions. We set up different pre-treatment and prognosis of the patients. We have guided the patients to be allocated in different regions in the hospital, and we have also strengthened up the protective efforts for the medical workers, especially in the key areas and the key departments. We have also strengthened up the key responsible person through the on-site training, internet remote training. We have improved the self-protective ability of the medical workers, and we have adopted a very strict measures to prevent the cross-intangencies between the medical workers. Fourthly, we have a very good grip of the general scenarios in the city. We adopted a scientific analyzing of the patient's demand to get into the hospital. For those of the medical resources which can be arranged, we arrange them to the patient at first hand. This has shortened up the gap, and this has organized all the medical resources in a more reasonable fashion. With China Daily, during your introduction, you have mentioned that the Jiangxi emergency medical team treat themselves as the local Suizhou people. How do you understand this? Thank you very much for your question. An outbreak of the pneumonia like this kind has shortened up the gap between us and the Suizhou people. We have treated the Suizhou people as a part of the people in the Jiangxi province. This is a requirement put forward by our governor and the General Secretary Liu Ji. We understand that we should think ourselves as a people in Suizhou. We are not guests for the Suizhou city, and we are going to join hands with the people in Suizhou to do a good effort. And all the Suizhou people, and we are a part of us, a family of us. We are also going to adopt a unified mechanism to help the people in Suizhou. We treat the patients as if they are our relatives and family members. We are making all untold effort to treat the patients in Suizhou, and we are also trying our best to deal with the emergency occurring in Suizhou. And for all the medical workers who are working at the Jiangxi medical team, we have one voice in our heart. Without getting a whole victory in Suizhou, we are not going back to our hometown. Thank you very much. With Chutian Metropolis Daily, we all know that the community and village are at the forefront of the containing of the COVID-19. So how will Suizhou activate all kinds of the strength and power to every forefront? Thank you very much for your question. For such a pneumonia occurred all of a sudden, we have conducted 3 measures. First, all the comrades and all the party members is working at the forefront. Starting at the first day after the New Year, we selected 1,500 CPC members to go to the community levels. And there are 47 different party members, among with 11,000 party comrades. We are working at the forefront. All the party members automatically take and shoulder the responsibilities to work at containing the COVID-19. As a party members, we are fully playing the role of the grid-based management mechanism. Up to today, there are 3,300 party stations in the whole city, with 55,000 different CPC party members and 7,500 community workers. They become a part of the workers servicing the communities, providing the temperature testings, logistic supplies to each of the communities. Secondly, we have a team of 9,000 different volunteers who are working at different areas, including the logistic supplies, the lockdown of the transportation methods, and also the containing of the COVID-19. For those of the members of the party, they have give us a lot of moving stories. One of the retired doctors in Suizhou County, Mr. Huang, who asked to work at the forefront line. He has been working at the forefront, even if he's retired. We need to learn from his experience and his spirit. Thank you. With Jiangxi Television, how do we improve the cure ratio and lower down the mortality ratio and the mobility ratio? What kind of effort did the Jiangxi emergency team did? Thank you very much for your question. To improve the cure, and lower down the mobility ratio is the core tasks granted to us. We have conducted several different mechanisms, including the special experts working online. We combine the TCM with the Western medicines, and we have also adopted a mechanism of early detection, early quarantine, and early treatment. We have also tried our best to avoid mild to severe cases. We have also built up a multiple discipline experts And we have adopted several different measures for a tailor-made, personalized treatment for one of the patients. We have also fully played the role of the remote medicine treatment. With one system, we covered 9 hospitals in Suizhou, and all of this treatment method is put into use. For the medical institution in Suizhou, they can share all the medical resources from the People's Hospital in Jiangxi Province and the first affiliated hospital at the Nanchang University. With the remote diagnosis and remote imaging diagnosis, we have built up a medical team who's never going to be tired. Thirdly, we prepare a 24/7 medical supporting team to Suizhou City. So with Yangtze Cloud, the Hubei province issued a risk analyzing report at the 27th. And in this report, there are risks toward risk analyzing to 103 different counties and regions and localities in the province. What is the measures behind this risk analyzing? And how did we provide adequate service based on different risk level? Thank you very much for your question. The medical risks evaluation report that issued by our province this time is being published according to the requirement of the prevention and control mechanism of the State Council. It is a part of the guidelines of the treatment, and the treatment requirement and criteria is based on the curves. No single confirmed cases and no single confirmed cases for 40 days in a row is being, for those regions like it, it's being categorized as a lower risk region. The middle risk region is being classified as that there is no crowding cases happen in the 40 days in a row. And for the high risk requirement, it is stated as that there is crowding risks in the past 40 days. Although we divided different regions and localities based on the standards as medium, lower, and high risks, we are not going to loosen up our requirement in different regions. Containing and controlling and prevention of the COVID-19 still remains to be one of our priority. We are making all-out efforts, and we are also going to control these special public places, and we are also going to provide a very good logistic supply with maintaining the social stability in the highly risk region. We are also going to continue our efforts of the detection, quarantine, and treatment. We are also going to provide and continue our lockdown in different communities, formulating a mechanism connecting and collecting different data. We are also going to strengthen the guarantees in 5 different aspects, improve the ratios of the cure, and lower down the mortality ratio. For those regions and localities at the lower risk, they are also going to follow up the requirement as the highly risk region, and they should use all kinds of measures to contain the rebounds of the COVID-19. Thank you very much for your attending of today's press conference. With that, we conclude.